Good morning. This is the day before April Fool's Day, and I will endeavor not to fool you. So here we are. There's so many disasters, and I am focusing on one today that is not as much in the news as some other things. But let me preface it by saying you've now heard and read that we've essentially thrown 80 years of institution building and policy to the wind, flawed as they may have been, but we've thrown them to the wind. And one of the things that we've thrown to the wind is international institutions, UN agencies, non-governmental organizations that have been built over decades, and that we either want to leave in the case of World Health Organization, or that we are underfunding, or that we've expressed no interest in. And of course, we've done the same thing domestically in the sense that the Doge, activities in various American governmental institutions is slowly destroying them one by one as well. And in terms of international affairs, one of the less written about, though it gets an occasional article, has to do with health. And you may say, well, we've got enough problems in Santa Cruz. I mean, we have a hard time getting doctor's appointments. Why could I or should I be worrying about health matters as they pertain to the rest of the world? But one of the things I want to suggest to you is that indeed we should worry about it, and I will try to explain why. So, while health and health funding and health issues and financial contributions to such from industrial countries may not be in the same category as military and economic issues, but they fall in a category of soft power. And one way that a country, including a powerful country like the United States, is to govern not just through hard power of military and even economics, but through soft power of having an impact on the quality, quantity of life around the world. After all, our population of 300 and something million people is a relatively small speck in a world in which there are 1.4 billion people, right? And we justifiably can be proud that in the 80 years since the Second World War, we have developed not only the strongest economy, although we're now undermining it to some extent, but we also have built a lot of soft power. That is to say, we've been at the forefront of institutions and subject matter, which enables the rest of the world, especially the non-communist world, but also the rest of the world, to better their lives, which the soft power of that, in a sense, strengthen us and has historically in terms of influence. And you can say, well, this is sort of altruistic, but my point, of course, is it's not entirely altruistic, because the kind of world we live in impacts us both directly and indirectly. So today I want to talk about health. The international structure pertaining to health is one, the World Health Organization, which, as you know, we're already leaving again. Flawed as it is, all institutions are flawed in some ways, and all would benefit from reform, including the World Health Organization, but leaving a central organization having to do with the health and well-being is not, I would argue, in the interest of the rest of the world, but also not the United States. For example, one of the things that the World Health Organization does, which I think I've mentioned before, is collect health statistics on a global scale, which we, by the way, have been using all these years. That is to say, our dependency of knowing various health statistics around the world has been on the World Health Organization because there was no reason to duplicate that. But the World Health Organization has also had a fairly major impact on the health and well-being of the rest of the world. Now, going away or getting away from the intergovernmental World Health Organization, there is an entirely non-governmental edifice out there, which has also done fairly remarkable things for the health and well-being of the rest of the world, including that of the United States. And what has that been? What has been the American Direct Connection? The American Direct Connection has been through USAID, which you know from the news we have disassembled. And let me talk about USAID for a minute, mainly with respect to this health and disease issue. The USAID, again, like any other bureaucracy, certainly has been ripe for reform. Reform both in terms of its operational structure in Washington, D.C., as well as its outreach, because most of the aid that USAID has provided, it's not technically providing it on its own. It is funding non-governmental organizations to carry out the projects and the activities, right? And so when one criticizes USAID, one can, one, be critical about the bureaucracy itself, and number two, one can show that there are some of these organizations that are funded to do one thing or another, excuse me, have also not been effective, and some of them have even been corrupt and so forth, but by no means the majority. Now, one gets the impression by listening to the news that a lot of your and my tax money have gone to USAID, and it's high time to get rid of most of the employees and to maybe keep some employees and put them in the State Department. But what a waste of our money. Well, the budget of USAID has been 1% of the US budget. Right? So to begin with, we're talking an infinitesimal amount of the annual US budget that has gone to USAID. That doesn't mean that reform wouldn't have been appropriate, that things can't be done better, excuse me, that, better institutions could be selected to carry out some of its policies. But what I'm saying is that this has not absorbed a huge component of the US budget and therefore our tax structure. Now, let me then talk specifically about some of the things that are out there and that we have participating in funding. Something that's called Gavi, which you probably never heard of, GAVI, is a non-governmental organization funded by governments, USAID in the past, we've quit, by the way, even some intergovernmental organization. And it's an alliance that promotes the use of vaccines. And it has been central to the promotion of vaccines, not only getting the funds that vaccines can be provided for governments who don't produce them or don't have the funds to purchase them, but also to make sure that diseases for which there are vaccinations, which have a tendency to spread not only within countries, but between continents, are attended to. What kinds of things am I talking about? Tuberculosis, TB, uh, various diseases, Ebola, cholera, yellow fever, Mpox. All of these have vaccines, and Gavi has been in charge of making sure that countries have access to those vaccines by paying them, by helping them, producers, bilaterally to donate them, by helping countries develop their own capacity to produce vaccines. So, for example, over the years, Gavi has managed to graduate 19 countries so that they don't need help from Gavi, but have the ability to produce the vaccines or have enough affluence to purchase the vaccines that are necessary for all the diseases that I just enumerated. Then there's a second organization called the Global Fund, which also fights diseases such as AIDS, TB, and, for example, malaria, for which there now is a vaccine, by the way, which most countries haven't had access to yet. So there's a second fund, again, non-governmental, getting money from governments and other institutions to make sure that countries have access to the vaccinations, and that the diseases can be under, some control. Well, we say to ourselves, that's not our problem. But just think about it for a minute. Tuberculosis. Tuberculosis essentially does not exist anymore in industrial countries. Very few people get TB. Many of them get it by having traveled overseas. And we have good ways of handling TB. Well, how do people in the United States acquire TB? Many do through travel or work overseas, right? And in countries where Gavi and or the Global Fund has attended to a radical reduction of TB and the ability to provide vaccinations against TB so that the rates go down lower, insofar as those two non-governmental organizations no longer are able to provide the vaccinations because of lack of funding and lack of support from powerful countries like the United States, means that these diseases are making a reappearance in larger numbers, which also means that when you and I travel in countries where TB had been pretty much under control, we might pick it up again and bring it to the US. Right? So the danger for industrial countries like the US is that the mechanisms, the institutional mechanisms, which provide the resources, the capacity, and the vaccines to control these diseases, insofar as that is being lax, is getting undermined because of funding, we can tell ourselves, well, this is not my problem. My problem is to get an appointment for, I don't know, a doctor here in Santa Cruz. But given the amount of travel and given the amount of exposure between societies nowadays, it is not difficult to imagine that the incidence of TB, of malaria, of any one of these diseases that have been brought under reasonable control will make a reappearance, right? And will harm us. So the one argument I'm making here is that rather than sort of saying, well, we're sick and tired of this USAID funding and groups and so forth, and we're getting out of the World Health Organization, and we're going to stop funding these organizations that provide vaccines around the world. This is not high priority for us at all. And even though our provisions, financial provisions to these organizations is very small as component of our overall budgets, still in all, we don't want to waste our money sending it overseas to all these countries. Who knows what's going on there, or who cares what's going on there? We have other fish to fry in the Middle East or somewhere else. By the way, these are issues even in the Middle East, in Syria and other places. So it's not true that this is just, in the poorest countries in the world. This has helped Central America, South America, various parts of Asia, and so forth. Is it short-sighted? Yes, it's very short-sighted. Are we going to become victims of this short-sightedness? Yes. Are we victims? Yes, not necessarily, but we have been in the past. For example, in terms of Ebola, right? We remember that needed to be clamped down very quickly, and was. But as the health facilities in the United States are also deteriorating, and clinics are shutting down here, there, and yonder, it is also the case that fewer and fewer of us are vaccinated and can be vaccinated and will be vaccinated within the U.S. if we need to be, because of the shortcomings of our policy. Now, there's a flip side to this, and to say, well, okay, I mean, if we need to, we can have access to vaccines, and our pharmaceutical producers will produce them very rapidly. Well, not so fast. Even here, there's an international component. For example, one of the largest companies which produces vaccines, pharmaceutical companies, is not in the United States, but happens to be in Denmark. Little Denmark, right, with a population of 9 million, has a very major pharmaceutical company, which, among other things, produces a large component of the medications, vaccinations, and so forth, for equipment for diabetics in the United States. Much of the medications for diabetics comes from Denmark, not entirely, but a large component of it. So now we're mad at Denmark. Why? Because Denmark objects to the US invading and taking over Greenland. Well, Denmark is a pipsqueak country. We, in the United States, what do we care about little old Denmark? Who is Denmark thinking that it can continue to have a say over Greenland when we want it and we need it? You may remember President Trump's comments about how we don't need to pay any attention to Denmark, and insulting them right and left. What this demonstrates is that even in the medical world, both for our domestic consumption and for our international consumption, we have, over the decades, become interdependent, and for good reason, right? Denmark's pharmaceutical industry doesn't just produce pharmaceuticals in use in the United States, but also part of the European Union, which Denmark is part of, right? And over the years, there has been a sense that every country in the European Union doesn't have to replicate every other country. So there is a distribution, in a sense, of emphasis. And if one member of the European Union has the capacity to produce or test, let's say, Denmark or England and so forth, they can share this with other countries. Of course, England is no longer, UK is no longer part of the European Union, but they're still cooperating with the European Union. So you can see here, we're sort of spinning in circles. What we're really saying is we, the United States, should stop wasting our money on all these ridiculous countries that, are malgoverned. Of course, we're not malgoverned. And or are poor, downtrodden third world countries. They're kind of hopeless. And in terms of health, the careful governmental, intergovernmental, WHO, and non-governmental institutions that have been built over the years and have developed capacity and linkages with the health ministries in various non-industrial countries. Who cares about them? It's none of our business. Come on, we just need to think about ourselves. This is not a problem. And we're the most powerful country in the world, so we don't really need any of this. Well, any of this, of course, means we forget about the level of interdependence, right, we have in the world, the travel and so forth. Well, of course, there's going to be less interdependence in terms of people moving, right? Because, of course, we're not allowing asylum seekers and immigrants and so forth to come into the United States. So that's less of a problem, right? If my argument is people from other societies also help to distribute diseases, then, of course, we have fewer and fewer people coming from other societies. So that's another reason why we can worry less about any of this. Now, one of the side effects of this has to do with other USAID programs, which are not directly linked to the provision and manufacturing and or purchases of vaccines, but are linked to the development of health ministries in those countries, right? And we have done much in terms of overseas funding, education, and so forth of the people in those countries to manage their affairs. You will know from your news and so forth what large percentage of US medical students, in fact, come from overseas, and many of them come from so-called third world countries, right? So our medical schools are full of people whose origins are not from the United States and who are on special visas, now some and or by now have green cards, whether it's doctors or nurses and so forth. Well, we're going to try to kick those people out too. What are they doing here? We don't need those people. As if we have the capacity to manage our own health system. By managing, I mean staffing, okay? So even on the staffing level, the idea that our interconnectedness in the health provisions, systems, developing of competency, training nurses, training doctors, some of whom may be staying here, but often who go back, is part of the dynamic of developing a global health system that has some ability to work. We're just saying we don't care. Why should we care? Let's stop all of this nonsense. And I can assure you that the number of staff from USAID who've been moved in the State Department are not ones that are looking after the management of the health and our interdependence internationally about health issues. And furthermore, are not in a position to monitor the degree to which people bring health issues back into the United States who travel. Right? Well, okay, so fewer Americans are traveling overseas. Okay, fine. But there's still a considerable number of Americans who professionally and non-professionally travel overseas and who could very well be exposed to any of these diseases, which in many cases have been brought under control in countries with the help of the World Health Organization, with the help of the USAID contributions to the to Gavi and the Global Fund. So it sounds sort of like I'm repeating myself, but I want to point out to you the circularity of all of this. And the circularity of all of this is to say, you know, America first, and America in a sense only. And this is, of course, true in other areas which I'm not discussing today. But it is very serious for us in terms of the health issues, which are increasingly going to dominate. Now, you might have heard, I'm sure you've heard about the horrendous earthquake in Myanmar and to some extent Thailand. Well, Myanmar is a very poor country. It has, so far, there are at least 2,000, probably more people who've lost their lives. It's a country that has a civil war, not very good. It's a country which has a very poorly functioning health system. And it's the kind of situation where in the days of yore, the US would have been first on the block to send help, as we did, let's say, in Turkey when the big earthquake happened in Turkey, help to try to dig out people and to try to manage the situation. And this is not happening now, right? We other countries have immediately sent help and are on the ground there, and we've said, well, we might send an exploratory person or persons to see what the situation there is. In other words, urgent and immediate care is not available. And of course, under circumstances of a bad earthquake, there's a question of safe drinking water and almost the immediate spread of tropical diseases and non-tropical diseases and so forth. So there's a health component potentially to an earthquake situation. Does that interest us at the moment? Absolutely not. Would Gavi and Global Health Fund be immediately there, trying to do what they possibly can before communicable diseases spread and people who, to begin with, don't have enough to eat and drink in a post-earthquake situation also can attend it to in terms of their health, situation? No, of course not. So the aspect that I'm talking about here is that not only should we be interested in our cutting back or cutting entirely our support to the intergovernmental and non-governmental institutions which deal with health issues in much of the world, chunks of Asia, chunks of Latin America, Central America, Africa, islands, and so forth. But we are losing and our self-interest in terms of could we in fact eventually suffer from the spread of some of these diseases, which I don't need to repeat and go into again. But we're also losing the soft power that enables us to have influence in other ways in those countries, which is derived from the fact that the US was always there and present whenever it was necessary to come in an emergency, right? And or to provide for the health and well-being of people. So now you have a situation where, for example, let's take South Africa, which is not one of the poorest countries, in Botswana, in Africa, where AIDS was rife and where AIDS has been managed, right? All of a sudden, the capacity to provide the medication for the people suffering from AIDS has not been available for several weeks, right? If this goes on, people will die. If this goes on, AIDS will have more likelihood of getting spread. So diseases like AIDS, which have been brought under control with the help of these international institutions, with the help of US funding, with the help of world organizations, with the help of non-governmental organizations, is creating disasters in some of these countries, which not only impact us if we travel and so forth, but are leading to unwanted death and chaos. So in countries, AIDS is a very good case in point, in countries where AIDS has been brought under control, which are quite a few countries, including to some extent ours, all of a sudden the medications are not available. And for countries to gear up funding and production and so forth and get it to the right places takes time. But in the case of something like AIDS, you can die in a month or two if you don't get the medication that kept you alive. So we're talking not only about long-term bad policies which may come home to roost in the United States. We're talking about death and mayhem in many, many countries. And we're not just talking about, poor people who have no resources and so forth. We're talking about the bureaucracies and the elites in many of these countries, where many of the people have had their diseases like AIDS under control. You better believe that people in ministries in some of these countries will be dying like flies unless something very quickly happens in terms of providing medication. So it is short-sighted, not just in terms of our long-term interests, but it's incredibly short-sighted in terms of the interests of us dealing with a reasonably stable world, and a world in which, in many so-called third world countries, the situation has actually improved. It is in many countries, even in Africa, the economic well-being, the educational level, and so forth has actually gotten a lot better in the last decade or so. And that's a separate topic for some other discussion. And under the circumstances, it is even more disastrous that the educated elite, that the kids going to school, that the kids going to universities, that the residents trying to leave and to become refugees, not because they're so impoverished, but because they're now affluent enough to hope for an even better life overseas. All of that is being frayed, and it's being frayed by the incredible short-sightedness, in large part by the most affluent country in the world, by the country who proudly can say it made a massive contribution to governmental and non-governmental organization. And it is a very sad tale, an important component of the erosion of the last 80 years of institution building, both intergovernmental UN and UN-related agencies, but also non-governmental organizations. It is a very sad happening. And if one is interested in the power and the capacity of one's own country to create a world in which everybody can live reasonably and in peace, soft power, which this was part of, is an important component of the kind of world we live in as hard power and military might. Thank you very much, and see you in 2 weeks.